After a while, we quickly have to go across and introduce our doctors first. Let's tell you who our panel of experts are. We have kept our WhatsApp lines open. We are getting in a lot of videos in the course of this broadcast. 10 videos that we received on WhatsApp as questions from you, the viewer. We'll go straight to the doctor. Let's go straight to our panelists and our experts. Some of India's best names are in our studios this evening. Dr. Trupti Gilada, who's an infectious disease specialist, live from Mumbai this evening. Sheetal Ranganathan, columnist of Global Health, also joining us live from Delhi, as experts also speak out with doctors. Also on the broadcast, Dr. Anant Mohan, who's a senior pulmonologist, joining us live from AIIMS in Mumbai. That's a small correction. Joining us live from AIIMS in Delhi. Before I go across and take any of those questions and play out your videos, and we will also take some questions from you, the viewer. We'll get you connected live. The numbers are on your screens. 73044 That's the number you can call us on. That's the number on which you can send us a video question, and we'll play that out. First up, my question to Dr. Anant Mohan. Dr. Anant Mohan, going by the number of cases that we are reporting, now something that we've heard from most of the experts and doctors is that most of the cases, that's over 130 cases, close to 130 cases, are all what you call imported cases, that is those who have come in to India from outside countries. What's the trend that you're seeing and that you'd like to share with our viewers this evening?
Yeah, so like you said, as of now, the trend has been that fortunately we don't have any clear-cut knowledge of community transmission of this coronavirus in our country as of now. Most of the cases, or probably even I could say all of the cases who have been tested, have some or the other direct or indirect link either to international travel on their own, or they have a link to contact with somebody who had an international travel to one of the countries which have been affected. So as of now, that is what we are getting, and we are not having any clear-cut evidence of community transmission, and all our efforts should be guided towards ensuring that it stays that way.
Okay, so let's take the first question that we're getting. The first question from our viewer, we'll play that out. The first viewer question sent on video on the Republic WhatsApp number. Let's play that question out for our doctors. And I'd request Dr. Trupti Gilada to take that question. Let's play out the first question.
So I had requested government also for any evacuation plan is there or not. But government has not replied me yet. I am waiting for it. But he is coming by his own arrangements. And when he reaches at Delhi airport, he has to undergo for the thermal screening and all those things. If he found that he is negative of coronavirus COVID-19, still he has to undergo for this quarantine in Delhi, or if yes, how many days?
Okay, Dr. Trupti Gilada, you want to take that question?
Can you please quickly repeat the question? The first part was very unclear.
Let's play out that, okay, for the benefit of our viewers and also Dr. Trupti Gilada, if you could just play out that question once again so that our doctors, a panel of doctors can hear it clearly. Once again, please.
Or if you could just repeat the question.
I'm very sorry, Dr. Trupti, even I couldn't hear it very clearly, and only for that purpose alone, I'm playing that once again.
Okay.
So I had requested government also for any evacuation plan is there or not. But government has not replied me yet. I am waiting for it. But he is coming by his own arrangements. And when he reaches at Delhi airport, he has to undergo for the thermal screening and all those things. If he found that he is negative of coronavirus COVID-19, still he has to undergo for this quarantine in Delhi, or if yes, how many days?
Dr. Trupti.
So I assume the question was someone, an international travel was at Delhi airport and tested negative.
Yeah.
And the question was, should the patient still be quarantined? And yes, for the 13 countries that we have on the list from the government of India now, irrespective of whether the person tests positive or negative, the person will be quarantined for a period of 14 days. There are different categories and of the person's age, the health condition, and whether the person has symptoms or no, and that will decide whether the person will be quarantined at home or in the hospital. But the quarantine for 14 days is for sure, even if the person is asymptomatic or test negative.
Okay, so what we'll do is we have some more videos. We'll keep taking those videos. We also encourage our viewers to call us in live. And you can call us in live. We will take your questions live on the show as well. You can call us in on the numbers on your screen. The numbers are 73044 34381. And we will put your call live on the show and you can ask the panel of experts on Republic TV your question. This is the second video question that we have received on the special broadcast and Dr. Anant Mohan can take this. Let's play out the next video.
Disinfect the surfaces like for plastic bags, items which maybe like the milk bags or so for whatever being delivered by delivery man. How we can disinfect those, provided I am not getting any disinfector either online or in local market.
Dr. Anant Mohan, do you want to take that question?
Okay, again the audio wasn't very clear, but what I think he was asking was how to disinfect or avoid getting the infection from the stuff which he gets from the delivery man, the plastics or the milk bags and other stuff. So see, sanitization of course is a paramount importance, and for household articles, as far as households are concerned, probably the simplest would be to make a bleaching solution, bleach, and make a solution of the bleach and use it as a disinfectant for the surfaces, because this virus deposits on these surfaces and from there it can very easily come onto your hands, fingers, and then the mouth, and also it can infect anybody. So disinfection of these surfaces is very important, and apart from alcohol based solutions which contain at least 70% of alcohol, or by thorough cleaning with soap and water for at least 10 to 20 seconds, the other thing may be the household bleach and the bleach solution, which may be an effective disinfectant which may be available to many people.
Okay, Girish from Ambala is our third viewer, writing into our newsrooms with his question on coronavirus. Girish from Ambala, let's play out his video.
हेलो, मेरा नाम गिरीश शर्मा है और मेरा सवाल ये है कि सोशल मीडिया में काफ़ी लिखा जा रहा है कि योगा करने से या मेडिटेशन करने से या फिर काऊ यूरिन से कोरोना वायरस को ठीक किया जा सकता है या इससे बचा जा सकता है। इस बात में कितनी सच्चाई है?
And I'd like our expert Sheetal Ranganathan to take that question. Sheetal, ways in which you can prevent coronavirus. I think this viewer Girish also went on to speak about whether yoga will help fight COVID-19. Now, many people say many things, but what do the experts say on the best practices and ways in which you can prevent yourself from getting infected?
Sure, I think the most important thing at this point in time is to really not be misinformed. I mean, yoga and meditation is good for general health, but they would not have any direct effect whatsoever in treating the COVID infection. I think the two best practices, that is the message also that the government has been giving, and all medical doctors have been telling at the top of their voices, to keep oneself clean in terms of cleaning your hands as well as disinfecting the surfaces that you're touching, and most importantly practicing social distancing as much as possible. You were telling on the program that so far the effect has been or restricted, or the testing has been restricted to people who've been identified as international travelers who've come from the identified countries, or by contact tracing all the people who have come in contact with them. But as we speak, ICMR is also running sort of an experimental exercise with about 1,000 samples from people who are showing flu-like symptoms but have had no travel history, or have had no contact with any patient whatsoever, to see whether community transmission is also taking shape within India. Because we've been able to save ourselves, or let's say we've taken the best steps possible in terms of controlling further import of infection from outside. But what one has to be very careful now about is that this infection doesn't go rampant in the community.
Okay,
So,
taking some live callers
short
on the
answer,
show.
just keep yourself clean, services disinfected.
Rajalakshmi is calling us in from Chennai. Sorry, Sheetal, I think I interrupted you there, but Rajalakshmi calling us in from Chennai. A lot of people calling into our newsrooms as well. So we'll take the videos, we'll keep the calls coming. Rajalakshmi, your question to the panel.
Yeah, doctor, I would like to know, see, I am from Chennai. Chennai realized that coronavirus is there and we have to take precaution very late because exams are going on, children are there, and there is a lot of senior citizens, and most of them are in this IT corridor. We have been exposed to all kinds of people who have been traveling abroad and coming, because most of the hi-fi gated communities are here, and there is a lot of socializing that has been happening. Now, what is the risk that we have facing, and what will happen to us? Because all of us have decided that we have to quarantine and we are all at home. But how long should we be there, and what else can we do not to be exposed to this virus? Thank you.
Dr. Anant, why don't you take that question? I think the importance of social distancing is Raj Lakshmi's query. Dr. Anant Mohan.
Yeah, exactly. So the first thing, the question is pertinent because there is a lot of traveling, there is a lot of exchange, foreign people coming, and of course there are problems of exams. So there are a lot of social problems, no doubt about that. But the only thing we can say is that we do not have all the answers as of now. For example, the question is how long do we have to do this? We don't have the answers to this question. The next couple of days or maybe 1 or 2 weeks are going to give a more clearer picture. If you go by the example of China and also currently what is happening in Europe, after the first 2 weeks, there is a sudden spike in the number of cases in the 3rd and the 4th week. So that is what is happening there. Now, we have to be careful that it doesn't happen over here. If that is so, then probably we are into the 3rd and the 4th week right now, or just about entering that. So we have to, another important thing is that we should not panic at all. First of all, there is no need to panic. We all know what has to be done. We are raising the awareness, social distancing. Of course, we are, everybody is talking about it. We have to maintain, non-essential travel has to be curtailed. Non-essential get-togethers have to be curtailed. So all these are precautions, important precautions that one has to take. That for example, work from home, even for patient, even for the healthcare system, I would go far as to say that even try to avoid non-essential visits to the healthcare system for a couple of days and see, because they are also, hospitals are extremely crowded, so you can very well get infection. So these are all the measures one has to take, and I hope that things will settle down soon. But we have to be very, very careful, no doubt about it.
Yeah, Deepa is our next caller, Republic viewer calling us in from Kolkata. Deepa, go ahead. And I'll let Dr. Trupti take your question.
Yeah. My question is that contamination can also happen through newspapers, or we have to receive the letters from the post office, or the postman will come. How can we prevent prevent ourselves from this?
Dr.
Have you got
Trupti.
it?
So as of now, I've got the question. As of now, we aren't sure for how long the virus survives on surfaces. There are various studies that say it might survive from 4 days to up to 24 hours. Irrespective of what we handle, the most important thing for the next 3 weeks is going to be extremely religious hand hygiene. So as long as your hand hygiene is good and you don't touch any part of your face with unwashed hands, you should be safe. Having said that, the other group of the people are the people who actually have respiratory symptoms. So people with runny nose, cough and sneezing are the people who will have to be extremely careful, use masks when they are in public, follow a very good hand hygiene to not cough in their hands and touch those same unwashed hands to other items or surfaces. That way the infection will be stopped at the source. But we really don't need to panic and stop receiving parcels and gifts. It's just that if you really are that skeptical, you can just disinfect it with the normal alcohol and the sterilium that we use to keep our hands clean.
Okay, so a lot of people are calling us into our newsrooms here, and we have received a lot of video questions as well. We'll play out those video questions. I think Tony from Mumbai is sending us the next question in the form of a video, but before that we have a caller on the line, Suresh. Suresh is calling us in from Ahmedabad. So from Kolkata to Bengaluru, Thiruvananthapuram, Chennai, getting in a lot of callers. Next caller from Ahmedabad. Suresh, go ahead.
Yes, sir. I wanted to know, how often do we have to change our mask, the mask that we are wearing and we are going out in the public. So how often do we have to change it every day, or a mask is good enough to protect us for a week or 2 weeks for that matter?
Okay, let me ask Sheetal to take that question. Sheetal, even the government has issued an advisory about masks, not to panic, and who needs to wear them. I think his question, I hope you heard his question. Question was, how frequently do you need to replace masks?
Yes, I did.
What are the different kinds of questions? Sheetal.
Yeah, so the mask, people are using masks. One, if you have flu-like symptoms, it is basically to ensure that we are not spreading droplet infection to the community or people who are, our caretakers or, are with us in the family. So for those people who are wearing masks who have these symptoms, one should change the mask every few hours. For others who, by the way, masks are not really advised by the government as a rule to be worn, but if somebody is just wearing it because they are skeptical enough, or somebody is suffering from pneumonia-like symptoms in their workplace or family, I think you could use 2 to 3 masks in a day, because it's mainly for protective reasons as a deterrent.
Okay, I hope that answers your question. Suresh, I hope that answers your question. Ajay is our next viewer from Hyderabad. So first caller from Hyderabad this evening. Ajay, good evening. Your question. Go ahead.
Hi. I wanted to ask my question as, will coronavirus be able to survive hot climate like we have it in India?
Okay, why don't you take that question, Dr. Anant Mohan? He spoke about coronavirus and its ability to survive temperatures like what we face here in India. Interesting question. A lot of debate around it.
Yeah, there are quite a lot of questions around this, and like I said, that this is a relatively new virus, so we don't know everything about it. Even the climate changes, we are not very sure, because there is a talk that it may not survive or it may get killed when the temperature goes beyond a certain level. While that might be true to some extent, we can never be sure as of now. And if that is the case, then even in tropical countries like Singapore and Thailand and Vietnam, we have had cases. They are all warm, humid areas. So we just cannot blindly go by this assumption that it may get killed or it may not survive in the hot climate. Only time will tell, and so we'll just have to wait and watch till that actual time comes. We cannot be definitive about that as of now.
Okay, taking in some video questions as well now. Tony sends us our next video question from Mumbai. Let's play that out, and let's also try and boost the audio so all our guests can try and hear that question.
Hi, myself Tony Budraj. I wanted to ask some few questions about it. It's like, am I risk for COVID-19 from a package of products shipping from China? Question number 1. And the question number 2, what is the source of the virus? And the rumors are going on, like people are stopping eating non-veg. Does this spread through non-veg also, or is it just a myth? I just wanted to confirm this.
Dr. Trupti, do you want to take that question?
So I'll take the second question first because I got that very clearly.
Yeah.
The infection first started in China from animals and it went to a group of humans, but thereafter the transmission has only been from humans to humans. So people who have flu-like symptoms like cough, sneeze, runny nose and fever are the ones who can transmit the infection to an uninfected person. Any other information about COVID-19 being spread through eggs, chicken, meat is absolutely untrue. There is no evidence of any animal transmission even from pets or cats. So people need not worry and think that the animals or meat is going to give them the disease. We only have to be protected from infected individuals.
Okay,
if you could
Kavita from
repeat the
Mumbai.
first question, that would be great.
Sorry, go ahead. Yeah, okay, we complete that point and then we'll take the next call. I'm sorry I interrupted you there.
I didn't get the first question, so either you could repeat that or we go on to the next one.
I think we'll take the next caller because a lot of callers are dialing into our newsrooms. Kavita is calling us in from Mumbai. Kavita, go ahead.
Okay.
Our panel can hear you. Okay, seem to have lost the phone line there. I think AK Dutt from Pune sends us the next video. Let's play that out.
Hello sir, good afternoon. I am Mr. A.K. Das from Pune. My son recently returned from France. He was in the official visit there and he has come on 14th March. So after all necessary formalities at the airport, at present he is staying at home. What are the precautions to be taken at home? He is okay at present. Thanks, sir.
Sheetal, do you want to take that question or should I ask Dr. Anant to take that? Sheetal.
Yeah, I think Dr. Anant.
Okay, Dr. Anant.
Yeah, okay. So basically he is in at home and kind of like home quarantine because he's just returned from a European country which has quite a bit of these cases. Again, the same principles apply. The same general principles that we tell to everybody. One is the hand hygiene, hand sanitization, frequent hand washing, not to touch objects, at least the surfaces should be clean. Whatever surfaces he touches, it is advisable that other people do not touch those same surfaces also as far as possible. Then to avoid touching the T area of the face, for example, the eyes, the nose and the hand, the mouth too frequently and then going on to touch other areas because that transmits infection. So this is general for all the people of the household. Apart from that, the cough etiquettes are extremely important. He is asymptomatic at present, so there is no cough, but still a bit of social distancing has to be maintained, and again 3 to 6 feet distance would be advisable as far as possible. If there is any cough or any sneezing, always it should be done in a cloth or a hanky or against the sleeve of the shirt. So these are a couple of things. And if there is any evidence of symptom, at the slightest evidence of any upper respiratory symptom, fever, cough or any sore throat, runny nose, I think the health authorities should be immediately informed so that testing and appropriate action can be done. So basically the principles remain the same. It is only that he has to maintain a kind of distance for a couple of days up to 2 weeks from the rest of his family members.
Great. Kavita is our next viewer from Mumbai. So Kavita, before you ask your question, we have an update from Mumbai. In fact, there is a very important meeting going on. This is a Maharashtra government meeting that will take a decision on whether the Mumbai Metro, the Mumbai Lifeline, the Mumbai Rail will be open, whether the locals will be open or will the lines be shut off for a few days given the threat. Now, there's a meeting on and the Shiv Sena says a key decision will be announced in a few hours from now. We're waiting for that. Kavita from Mumbai is our next viewer. Kavita, go ahead.
Yeah, I have one question. Can you hear me properly?
Go ahead, Kavita. We can hear you.
Yeah, my bhanji is in Delhi and her parents are in Mumbai and my bhanji is expected any time. So is it good to travel over there to her at this situation? Is it advisable to travel to her for her delivery purpose? to her parents to go over there in Delhi. For delivery.
Sheetal, you want to take that?
Can you hear me properly or I will repeat it
Sure.
again?
So my advice right now, yes, so my advice personally would be that if it is non-essential and if it can be managed in Delhi, that is the more advisable thing to do. And
Okay, I request all our panelists to stay with us. We have a few more videos to take. Dr. Anant Mohan, Sheetal Ranganathan and Dr. Trupti Gilada, I request you to stay with us a few more minutes. We'll take a short break, we'll come back. We'll take some of those video questions, we'll take some callers, and we'll also get the live update from Mumbai. Stay on with us few more minutes. We're taking your calls and your videos live on Republic TV. Stay tuned.